Joining us from Simpson Dental, we have Dr. Kristen Simpson today. Thanks for joining us.
Thanks for having me.
Yeah, I bet you hear this a lot. Some people are a little nervous about going to the dentist.
Yes.
So help us out here. What kind of questions should they be asking?
Yeah, well, dentistry's changing so frequently. There's so many updates with it, and people might not know what questions to ask about what type of care they need, and they're just scared about it. So we'll go through some of the common questions that we get and some tips for what you might be looking for in the answer of these questions.
Oh, that's
so the most common question that we get is, how much is something? So, that's always, I think maybe if people just don't know what to ask, that's just where they go first. And it is, of course, an important question, so you can budget for it. But first, you want to make sure that you're comparing apples to apples, and that when you're asking how much is like a crown, that it's the same type of crown from one place to the other, or that you know what you're getting there. And sometimes, you might not need the crown, maybe it's something else that you actually need. So it's best to just come in to have an initial exam to see what you need, to then figure out the price. A lot of times they might ask over the phone, how much is something? Well, that's really hard to tell until you get in and have us take a look and see exactly what your needs are.
Is it okay to ask you what type of materials you're going to be using during this procedure?
Yes. That's very important to ask, because you want something that's going to last, so you want to have stronger materials. So a lot of times for back teeth, we recommend using gold. Gold is a great restoration to use because it's very malleable to the biting pressures and seals really well. Porcelain has come a long way, looks very aesthetic and can be just as strong, so porcelain materials are great as well. A lot of times the plastic materials, composites, they're good for smaller fillings, but you just don't want to use them for large fillings on back teeth because they just wear down so quickly. So that'll be something you'll have to replace every 3 years. So they say they only last 3 to 5 years. So you probably will want something that lasts longer on a back tooth.
Okay. What about the lab? What kind of questions do you think are important to ask?
Well, so you want to know what lab is making your restoration. So at Simpson Dental, we have our own lab, so we're able to control everything that happens with the restoration and make sure that we're using the best materials. If you want to go somewhere and have a cheaper restoration made, they might be mailing it off to China or somewhere else to have that restoration made, and you're not sure what's in it. So we make sure to control the materials and the products that we're using so that they're longer lasting and the best fit and quality for our patients.
Okay. Talk about if someone is wanting to know about their follow-up care. Are there certain questions that they really need to ask?
Yeah, that's very important to ask. A lot of times people think, oh, I'll get this fixed and then I won't have to do anything. Well, you have to maintain something. Like, if you go and buy a new car, you can't just drive it and never have your maintenance done. So same with your teeth. You're going to have regular maintenance, your regular follow-ups every 3 to 6 months. Sometimes with implants, there are parts and pieces that might have to be changed out. So you just want to make sure you ask those questions before you have the procedure done.
Is it okay for patients to ask how long you've been doing treatment?
Yes, that's a good question to ask. Experience is important when it comes to dentistry because you've seen how things can go wrong, you know how to fix them. So I've actually been practicing 18 years now, and my dad over 40 years. So at Simpson Dental, we have a lot of experience at our office, and we know how to handle situations to get the best outcome.
Yeah, and I bet you do get asked this one a lot. If you all have had a patient who has had the same procedure that you're recommending for them.
That's right. Yes, that's a good question to ask because you might be scared on how the procedure is going to work, what's involved with it, how you're going to feel after. So, talking to someone who's had it done that can tell you exactly what they went through would be, some good information to have so you'll know what to expect.
Yeah, I think that a lot of these questions will help reassure patients, and so like you said, it's good to ask, maybe even come with questions, right, or bring a family member with you to help you remember all these questions.
Definitely.
Yeah. Well, Dr. Simpson, thanks so much for talking to us about this today.
Sure thing.
Yeah.